So welcome to this Precizion podcast. And I'm here again today with Dr. Joshi. I'm so thrilled she's agreed to come back and have another chat. And today we're going to tackle some of the perimenopausal symptoms that women suffer. Because really, you know, in my experience, for sure, it was that time coming up to when my periods ceased to appear that actually presented the most challenges, and that was the time when I felt like maybe I wasn't getting the help that I might have liked. So, you know, what kind of age can we expect to start to experience some of these symptoms, Dr. Joshi?
Hi again, Philippa. It's nice to connect with you. No problem. That's all right. It's always good to get to the topic. So let's start discussing by what exactly we mean by perimenopause. Most of us are aware of the word menopause, but when it comes to perimenopause, it's very differently defined everywhere. But most experts would actually agree that it is that time around which the periods in women start getting irregular, courtesy generally to the declining levels of estrogen in the body. And then eventually this period ends a year from your last menstrual period. And that's when you hit the menopause.
Yeah.
Peri, as most of you would be aware, is from a Greek word which means around or nearby.
Oh.
So it is like the transition phase. Okay. Now, the average age would be between 40 to 50 years. I know it's a very broad range, but that is the broad range we actually see. Average duration for women is 3 to 4 years, but for some, it might just last a few months, whereas for some, it might go on for a decade. The same when it comes to the symptoms. For some, they wouldn't even notice, whereas for some, it might be a wide range from hot flushes to, you know, flooding with their periods and things like that. And they could be really, really bothersome.
Yes, I mean, you know, it's kind of interesting that it's only really on looking back that I sort of pieced the puzzle together. And actually, you talk about irregular periods, but I had regular periods until the day that they stopped. In actual fact, I had periods every 3 weeks for 5 years.
Oh, yes.
Every 3 weeks, and heavy, and you know, sometimes difficult to go out and socialize because of, you know. But so you know, it's not even always the case that our periods give us those messages. So there's a whole range of symptoms, aren't there? And some of us will have some of us will have them all, and lucky some people will have none at all. So what kind of symptoms are we talking about that might herald this transition, this period of transition?
Very rightly said, Philippa. There are a wide range of symptoms. Now, fortunately, as our knowledge of reproductive aging has increased, we've come to, in a way, a lot of evidence base. And so starting from hot flushes and night sweats, about 3 to 5 in 10 women would experience these. Okay. You'd literally feel like you're on fire at times. Okay. And that again could be put down to lack of estrogen in the body. It is these hormonal variations that cause this particular symptom, definitely.
Right.
Hand in hand with the night sweats goes the insomnia and sleep disturbances.
And not just because we're on fire. I used to say the only time I get these hot sweats is at night. I feel like I'm on fire, and not in a good way, you know.
Yeah, absolutely.
But I mean, so the sleeplessness isn't just because we're waking up in a hot sweat, is it? No,
Not
that's not what
really,
we mean.
not really. So I'd say about 4 in 10 women again experience sleep problems. Now that could not be put down to just night sweats, but it's a part and parcel of the aging process. So it's very hard to say. But along with that, even the changes that we're undergoing in terms of our mood and our ability to cope with a lot of changes happening in life. generally the perimenopause period is the period in which women would see their children go away to university, or you would experience some illness in the family, for example, losing your parents and things like that. So it's very hard to say. Like I said, evidence says that you can't blame just the hormones for the sleep disturbances, but it is a small part of it.
A contributory factor. Yeah.
Definitely.
No, I mean, I think this is right. The hardest thing really when we, practice medicine, I physiotherapy, you obviously, your obstetrics and gynecology, but it's separating out, it's unpicking this picture, which is so complex and so individual as well. These experiences are so individual. But I know from my own perspective, I suffered palpitations, the memory, that thing is, gosh, I really seriously, I took those online tests. Are you getting dementia? I did them. And I was, I'm thinking, this is really what's happening to me. I'm losing my mind. And I can't remember a thing, and then the emotional side of the house with either low mood or sometimes this massive fluctuation in mood associated around the cycle, so that the premenstrual kind of symptoms that maybe I had much more before I had my children, when I was, younger, kind of came back with a vengeance. Breast, oh my gosh, like bullets. And so, I'm not looking for sympathy, but there is, I am
very true. Yeah. Not very nice memories.
No,
but yes, I mean, like I said, fortunately we have lots of ways to deal with it, and we'll get to that. But while we're on the topic of mood symptoms, a lot of women also tend to get very anxious or irritable, very easily irritable, and all of this could be put down to the hormonal fluctuations. Definitely.
All right. So we can categorically say that we're not going mad with this. It is really. Yeah, because it can feel a bit like that when you don't know from one minute to the next whether you're going to burst into tears or go into a rage.
Absolutely. And again, it's very variable for different women. Yeah. Some of us are more prone to hormonal changes, whereas some of us are slightly less prone in a nice way. So
yes, yeah. Well, this is it. And so for those women who are or those people who are not experiencing these problems, then that's fabulous for them. But there's lots of people who are, and then like you said, dealing with stuff at home and then working as well is the other thing that people are increasingly, women in the workplace working longer, when previously they might have been retiring from work, carrying on through peri-menopause, menopause and beyond. So this is so important that women are aware of the different kinds of symptoms that can be occurring, and then of course what can we do is it becomes the question.
Sure. Just a few more symptoms I'd like to flag actually before we get to the management. Vaginal dryness. Vaginal dryness is something that's very commonly experienced actually during late perimenopause. It actually doesn't come only after the menopause, so it could be either in the form of itching or irritation or painful intercourse.
Right.
And sometimes that can even lead to your sort of reluctance for sexual intercourse and all of that. So I mean,
not to mention the fact that you're shattered and you
absolutely. And the uterine bleeding problems, like you said, you were fortunate enough to escape that bit, but a lot of women do experience either irregular periods or very heavy bleeding or very scanty periods. And it is slightly worrying because you're used to something going like clockwork and then things suddenly change. So I completely understand why it's worrying.
Yes, yeah. Any change, really we're programmed to respond to routine, and so these changes really can throw us off. And like you say, getting caught off guard when you're out and about with a period is not a pleasant thing to happen to anybody.
Not at all. Not
But
at all.
I mean, the dryness, there are treatments obviously for this, aren't there?
Yeah,
Are other
absolutely.
symptoms we should talk about before we?
I think we've generally covered most of them. So
Yeah.
let's get to how to deal with it. It
Yeah.
is a slightly rocky road, but there is help available. So let's start with medically, we call the hot flushes the vasomotor symptoms as
Oh
such.
yes, yeah, yeah.
So uh, I think the first rule of thumb would be to try and avoid the trigger factors. I don't know if you noted with yourself, but evidence does say that there are definite triggers to the hot flushes. For
Mm.
some women, it could be either spicy food. For some, it could be certain hot beverages. For some, it could just be exposing yourself to hot temperatures and not keeping yourself cool. So definitely trying to avoid that is the best way out. Okay.
Yeah, I mean, from my point of view, it was predominantly in the night, and so not in the day. Uh,
Sure.
but what I definitely noticed was it did matter what I did during the day, and particularly any time after midday. Uh,
Mm-hmm.
you know, whatever I had been consuming in the afternoon. So, for instance,
Mm-hmm.
caffeine, I definitely noticed that had a bearing,
Mm-hmm.
and alcohol. That was
Sure.
just an absolute no-no,
Sure.
and still is. And salty, very salty foods, which
Mm-hmm.
contribute to, I guess, dehydration. Perhaps
Mm-hmm.
that's
And fluid retention also. So that
oh
makes you, in general, wary. So the more salt you have, the more fluid your body will retain because it tries to balance out what we call as the osmolarity in the body. So
yes, yeah.
that's why the body, it's like a response of the body. So
So does that? I mean, I felt like that
yeah,
definitely
yeah, absolutely.
contributed to
That's very
those
good
emotions.
observation. Yeah, yeah, yeah.
Yeah, yeah.
So like you did yourself find your triggers. I would encourage every woman to try and find what her triggers are. It's different for everyone.
Yeah, and
And
I heard an interesting thing this week as
mhm,
well about the link between cortisol, high cortisol levels,
mhm, yep,
associated with stress, obviously cortisol,
absolutely.
and having increased vasomotor symptoms.
Very true. And then cortisol as a cycle in itself sort of increases or early hours in the morning or late in the night in the body. So that's what could be
Mm.
linked with what you experience as night sweats, if that
Yeah,
makes sense.
early hours of the morning, definitely that sort of waking up with palpitations in a
Yep.
hot lather, in
Hmm.
those early hours.
Yeah.
And so that's a cyclical hormone in
Yeah.
the same way.
That's how
Yeah.
it works for everyone. So
I mean,
and
sorry, this is kind of difficult. I sort of, sometimes we talk about stress being a trigger, and
mhm,
that it's a stressful time,
I
so
agree.
you're kind of inherently stressed, and of course you don't want to feel like people are being blamed for having these symptoms, because
Yeah, definitely.
sometimes these stressful experiences are out with our control, whether it's through work or home life or whatever, but I do feel that it is an important thing that we can do to help ourselves to manage these stressful situations, stressful experiences, and that there are simple, relatively simple and brief interventions, health
Mhm.
interventions that we can make in order to achieve this improvement in stress levels. So
Sure.
is that something you would go along with?
Definitely. As it said, it's okay not to be okay. So it's definitely something that we need to deal with when it comes to stress symptoms, either getting counseling, what we call as cognitive behavioral therapy, or there is medical management for it also when it
Yeah.
comes to definitely perimenopausal symptoms. So the medication that we routinely recommend is called as serotonin reuptake inhibitors. So serotonin is the feel good hormone in the body, and with perimenopause, a lot of it is seen that causes the low mood or the depression or sometimes the anxiety. So these specific drugs, of course, any medication comes with its own set of side effects. So it's about weighing how severe the symptoms are and whether the medication is needed or not. But the first line would be trying and getting some kind of counseling or some kind of help, someone to speak to. when it going back to the vasomotor symptoms we were speaking about, actually, there is definite evidence to say, because this is your topic, so paced respiration or deep breathing exercises and things like that actually help. So there is definite evidence to support that.
Yeah.
It's only, and especially with the hot flushes.
Oh, so that's interesting. And that's really through managing these cortisol levels.
Absolutely.
Yeah.
Very true.
Yeah. So we can help the manifestations of stress in terms of hot flushes, but also sometimes anxiety related experiences too. Yeah, no, I mean, this is obviously lifestyle factors are free and relatively readily available. And it's but it's a question of experiencing the benefits, because I think it's sometimes difficult to believe that something that can be so debilitating and severe can actually be helped by relatively innocuous interventions such as deep breathing.
Deep breathing, sure.
But I think the thing that gives the impact the most is doing these things regularly. So that any lifestyle intervention, I recommend we use it like medication, which is, if you would be happy to take a tablet 3 times a day, then why not just a few minutes of some kind of lifestyle intervention 3 times a day? And I know the evidence is that we will likely fit those in better if we tag them onto other things that we do every day. Whether it's every time you put the kettle on or every time you brush your teeth. I mean, you're going to do that twice a day. Just to somehow get these things into our lives. And then if we tried it and it didn't work, then at least we know that there are other things available. Because I think, I know this was suggested for me, but I didn't really fully understand how these things could help, so that when it's recommended that you take one of those serotonin
SSRIs, like we like
SSRIs, that's right. Sometimes your brain immediately transports you to a place of judgment, which is, I'm having depression and therefore, but so how do we get around that, do you think? How do you explain it to people, how these particular medications are going to be appropriate in what instances?
Okay, so I would say when it comes to severe hot flushes, so firstly, of course, we try all these lifestyle management techniques, and if they don't work and you're still definitely suffering from severe hot flushes, you're unable to sleep, or it makes you very uncomfortable when you go out and things like that, we would try and go on to the second line of management.
Right.
And that would be these drugs. So they're a class of neuroantidepressants, but I wouldn't want anyone to feel that they need it because they're depressed. It's not because of that.
Right.
It's just that they work on those hormones in the brain. And all these hormones are so intricately linked that sometimes a change in a certain hormone actually has another kind of effect in the body. And it's not just for the depression, but it's for the hot flushes.
Yeah.
If that makes sense.
Yes.
So it's not only the SSRIs like we spoke. There are certain other drugs, certain anti-epileptics, which can actually be used for hot flushes. For example, gabapentin. So it is used as an anti-epileptic in certain women. Whereas it could be given for severe hot flushes. So everything is not exclusive, like we know. So certain medications can be used in both ways. So I wouldn't want anyone to feel that they're suffering from another kind of disease when they're having something. And I'm sure before we start something like that, we will have a detailed discussion with the person. So
yes, of course, yeah. I mean, my experience was, I think we said this before we started to talk, that for most women, the management is in general practice. For most people, the management is in general practice. And so unfortunately for the GPs, the time is often limited, and to get digging deeper into these kinds of conversations, by the time you've told them a whole list of symptoms, it becomes difficult to have these conversations in the time allotted, and so you find that you've thrown a piece of paper, go to the pharmacy and collect this, and maybe, and as well, your memory, you're like, oh gee, I wish I'd asked if
So true.
Before you know it, you're out of the door with the script in your hand going, I'm not even really sure why I'm getting this, but no, I think you've cleared that up really very nicely. And it is this interaction, very complex relationship between the hormonal system in the body. And that's why the lack of estrogen or the declining estrogen levels have such a widespread impact, isn't it?
Absolutely. Yeah. The other form of management is what we call as low dose oral contraceptive pills.
Oh, okay.
So for women who don't have the contraindications, who are not smokers and who are not at very high risk because of those pills, in the perimenopause period, these pills actually form the second line of management for a lot of the symptoms, whether it be the vasomotor symptoms, whether it be the irregular periods. It does have a good effect, and it also has a good effect for the vaginal dryness, actually.
Oh, interesting.
But yes, with the vaginal dryness, the first line of management would be the local application of either the estrogen cream or the gel, or even the ring form that is available. And yes, along with the lubricating jelly. So hand in hand, both of them go in together.
Yes. Okay. That's that's not something that I experienced. I have to say, but I do know lots of people do. And for some people, I heard a friend talk of someone who was even experiencing discomfort just walking down the street. Just the very act of moving was, and the friction that this person experienced was a source of, great distress and discomfort. So it doesn't even necessarily have to be, intercourse that might manifest.
It's just the general dryness and itching. I mean, vaginal hygiene is a completely, I think we'd have to spend another hour on it. So, but I would definitely recommend, if needed, getting yourself referred to one of our vulval or vaginal clinics if it is so much discomfort like you're describing, because it's a quality of life thing. No one should live with something like this.
No, you're absolutely right.
And there is wonderful management available. So it's very hard for me to generalize at present because it would be very patient based. So I wouldn't want to generalize right now, but there is wonderful management available.
Yeah. That's really good news, isn't it, for people?
Definitely.
And that increasingly we're raising awareness. We know it's World Menopause Day tomorrow, and that's why we're here giving our time freely on the weekends. And I'm so thankful that you're passionate about this topic and sharing information. And as you say, it's really important that people seek tailored advice from their own medical professionals, but to know that there is help out there, really, and to know this is what it is, because there's so you do find yourself wondering what on earth is happening. So have we got any top tips, do you think, Dr. Joshi?
Sure, Philippa. I think my take-home message for everyone here would be, firstly, just lifestyle changes, healthy eating, stop smoking, try and reduce alcohol intake if possible. Just see what your triggers are and try and get on top of those. Definitely. Get more sleep. It is essential. Exercise and deep breathing activities and things like that. Maybe get a good lifestyle interventionist to speak to if needed. And yes, of course, if needed, go and speak to your doctor. We're always here for you.
Yeah.
The other thing I heard, and a lot of women actually like as advice, is dress yourself in layers. If needed, you can always lose one. So that's it from my end, Philippa. Thank you for having me.
Oh, thank you so much. Thank you so much for your time. And we will speak again very soon, I hope.
Sure.